Hello, and welcome to the first issue of Stroke Insights. Today's presentation will be focused on the Get With The Guidelines date and time of patients last known well. This is based upon the Get With The Guidelines stroke coding instructions updated in June of 2023 and the Joint Commission specification manual starting with July of 2023 discharges. Please note, for the most accurate guidance, refer to the version of the specifications manual and coding instructions that correspond to the discharge date that is being reviewed. At the completion of this presentation, the attendee will be able to use the current Get With The Guidelines coding instructions and the Joint Commission's specification manual to decipher the earliest, most appropriate date and time for last known well, and to differentiate between the Get With The Guidelines last known well date and time and the Joint Commission last known well date and time. The sources we are using are the Get With The Guidelines stroke coding instructions for June of 2023 and the specifications manual for Joint Commission National Quality Measures version V 2023B. The definition of patient's last known well is the date and time at which the patient was last known to be without the signs and symptoms of the current stroke or at his or her prior baseline. The question that is documented in the abstraction is what was the date and time the patient was last known to be well. Well can be defined as the patient's baseline or usual state of health. The purpose of this data element is to identify the earliest possible time that the stroke symptoms began. This may or may not be the same as the discovery date and time, but it should be the closest time in which there is clear evidence that the patient was at their previous baseline. The time of last known well is often mistakenly recorded as the time of discovery. It is imperative to distinguish the time difference between time of last known well and symptom discovery as to avoid inappropriate use of IV alteplase. For example, if stroke onset time is listed without reference to the situation prior to its findings, then this onset time would be used as last known well. If there is reference to the patient having been found with symptoms already present, then this onset time would be used as the discovery time. When the discovery is documented, but the start of stroke symptoms are not witnessed, and there is no last known well documented, then you would select unknown for the last known well. When the start of stroke symptoms are clearly witnessed, then the last known well time and the discovery time are the same. If the last known well is noted to be a range of time prior to arrival, for example, 2 to 3 hours ago, you would use the maximum time for the range and subtract that time from the arrival time to calculate the last known well time. In this example, it would be 3 hours. The purpose of the last known well is to conservatively identify and estimate the time of symptom onset. You use last known well to identify when the patient was either last seen or last known to be well. This may change with various observers. If the last known well cannot be identified, you would indicate that the last known well date and time is unknown. If multiple times of last known well are documented, you use the time recorded according to the following hierarchy, which is listed in the Get With The Guidelines stroke coding instructions. First is neurology. Second is the admitting physician. Third is the ED physician. Fourth is the ED nursing notes. And fifth is EMS. If there are multiple dates and times documented by the same provider, you use the earliest date recorded by that provider. Patients may have transient symptoms which resolve and are later followed by symptoms that do not resolve and result in admission to the hospital. If there is documentation of one or more symptomatic episodes of transient symptoms and documentation of symptom resolution between episodes, for example, the patient returns to baseline, you would then enter the date and time of the most recent or last episode here, even if it occurs after hospital arrival. For example, patient with right-sided weakness at home on August 31st at 8 a.m. Upon arrival to the hospital, the physician documents that the patient is symptom-free and also documents an NIHSS of 0. A facial droop was noted at 10:30 a.m. while the patient is in the ED. A repeat NIHSS was performed and documented as 3. The last known well date and time for this patient would be August 31st, 2023 at 10:30 a.m. The Joint Commission's definition of patient's last known well is the date and time prior to hospital arrival at which it was witnessed or reported that the patient was last known to be without the signs and symptoms of the current stroke or at his or her baseline state of health. The question in the abstraction is there documentation that the date and time of last known well was witnessed or reported? The allowable values are yes or no. Yes, there is documentation that the date and time of last known well was witnessed or reported. Or no, there is no documentation that the date and time of last known well was witnessed or reported, or you are unable to determine from the medical record documentation. Please note that the last known well for the Joint Commission needs to have a date and time documented, and it needs to be prior to patient's arrival to the hospital. The Joint Commission's last known well is collected for the acute stroke ready inpatient, acute stroke ready outpatient, and stroke 4 measures. You would select yes if both a date and time of last known well are documented, and you would select no if there is any physician, APN, or PA documentation that the last known well is unknown. Documentation must explicitly state that the last known well is unknown, uncertain, or unclear. We do not make inferences. The inclusion list for acceptable terms for signs and symptoms of stroke is not all-inclusive, and it is listed in the stroke coding instructions. They include sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, a sudden severe headache, syncope, or a seizure. The exclusion list for acceptable terms of signs and symptoms, which is also listed in the stroke coding instructions, includes a delay in the stroke diagnosis. The time last known well must be a time prior to the patient's arrival time. For the Joint Commission's last known well, we do not use times after hospital arrival. If there are multiple times of last known well documented by different physicians or by the same provider, you will use the earliest time documented. If there is documentation of one or more episodes of stroke symptoms and documentation of symptom resolution between the episodes, you will use the time of the most recent or last episode prior to arrival, regardless if all symptoms resolved prior to arrival. Example scenario 1. Beth arrived in the ED with her son on September 5th at 12 p.m. Her son states that he last saw his mother last night at 7 p.m. after taking her home after dinner. Beth awoke this morning at 7:30 a.m. and noticed that her right arm was weak. The weakness did not get better, so Beth called her son at 11 a.m. He came over right away, concerned that his mother may be having a stroke. Beth's granddaughter arrives and states that she spoke to her last night at 9:30 p.m. and that the patient did not complain of any weakness or symptoms. For this scenario, Beth's last known well would be September 4th at 9:30 p.m. when her granddaughter spoke to her and she did not complain of any weakness or symptoms. The discovery for Beth would be on September 5th at 7:30 a.m. when she woke up and noticed that her right arm was weak. Example scenario 2. Tom had a brief episode of slurred speech at 3 p.m. on August 5th while he was at work. The episode resolved quickly and he returned to normal. At 7:45 p.m. on August 5th, the same day, he developed left-sided weakness and slurred speech after dinner. His wife insisted on going to the hospital, where his weakness and slurred speech persisted. For this scenario, Tom's last known well and discovery would be the same. The last known well would be August 5th at 7:45 p.m., and the discovery would be August 5th at 7:45 p.m. due to his 3 p.m. signs and symptoms resolving, and when they returned at 7:45 p.m., that would be his most recent or last episode of the signs and symptoms. Example scenario 3. Peter arrived to the ED via EMS on July 5th at 8:59 a.m. His daughter states that he was found at 8:30 a.m. on the bathroom floor, and I couldn't understand what he was saying. On further questioning by the neurologist, the daughter states that her father ate breakfast at 7:30 a.m. and then went to go get ready for the day when he was later found on the bathroom floor with slurred speech. In this example, Peter's last known well would be July 5th at 7:30 a.m. because that is when he ate breakfast and he was in his usual state of health for his daughter. The discovery time for Peter would be July 5th at 8:30 when he was found on the bathroom floor by his daughter. Example scenario 4. Simon arrived to the ED via EMS on June 5th. Paul, the patient's son, states that the patient was okay last night before bed. Paul then found Simon this morning at 10:17 a.m. with weakness and confusion still lying in bed. For the Joint Commission, the last known well would be no, as there was no time last known well documented. The last known well for the Get With the Guidelines would be June 4th, because the son noted that the patient was okay last night before bed. The discovery for Simon would be on June 5th at 10:17 when he was found by his son still lying in bed. For further information, please refer to the links below. For abstraction queries, please submit your questions to your AHA rep via email or phone. Please see below for the acronyms and abbreviations used in this presentation. Thank you for watching. I hope to see you next time.